Hi, everyone. Welcome to the Unison Community Podcast. I'm the host and founder of Unison, Gabriella Newell. We hope you'll continue the conversation with us at unisoncommunity.com. Hi, everyone. So we have Pelagia Candelas here with us today, and she is a medical student at Drexel University. She's currently applying for her residency in internal medicine and has an interest in patient advocacy, and she really hopes to demonstrate and embody this in her future practice as a medical professional. So thank you so much for joining us today.
Yeah, I'm so happy to be here. It's a pleasure.
Amazing. Let's just get right into it. What does patient advocacy mean to you at a high level or in the day to day?
Yeah, so I think that patient advocacy is so important to me, and I think that it overlaps in so many different things. So on the day to day, it's as simple as, advocating for somebody because, they really want a glass of water and they haven't been able to get it and they have a need that's just, a human need, but also advocating for them when it comes to medicine. And, maybe they're not getting the best care, or maybe a specialist that they were seeing was not giving them the best care there. So I think it goes kind of in the medical field, it goes on a whole spectrum of personal human needs, but also medical needs. So I think that it's so important, and I don't know, I feel like it's like you have to have that as a doctor.
Definitely. So it sounds like there needs to be a balance, and that can sometimes be difficult in the hectic, chaotic day of a doctor is what I'm hearing. And so I'm kind of wondering, how do you find that balance? Like, how do medical students balance learning clinical skills with developing compassion and communication? And then how does that kind of, I mean, obviously you haven't experienced it yet, but how would you think that it would evolve over time in an ideal career?
Yeah, so I think the balance is like the hardest part about doing any of this, is trying to find a balance. I'm really busy even as a medical student, and just as you get further and further as a doctor in your career, you become even more busy. But one of the good things is that the patient interactions that you have, the positive ones, are kind of what keeps you going. On those really tiring days, it's what keeps you going. So I think what I make the time, I make the effort to spend maybe a little bit more time talking to a patient and advocating for, the specific need that maybe somebody did not think was super important. And just the way that they appreciate you and they come back to you and they just have this such a strong bond with you is kind of what keeps me going. So I think what I do is I intentionally make the time before I leave the room, saying, is there anything that you need? This is your time to tell me. If not, I'll come back and we can talk about it later. So I think it's just like really making the effort and like trying to be really communicative and giving them a lot of time and space to kind of say what they need.
I really like that. I think a lot of us in the patient setting feel a little bit rushed and kind of just wanting to get our answers, not even thinking about, do I have everything I need in the moment? And you creating that space almost gives us permission to advocate for ourselves. And we kind of talked about this a little bit before the call, but I'm curious, in your experience, I think what advocacy means for women is very different. And so just wondering, have you noticed anything specific to either how women advocate or where they struggle, just from your perspective?
Yeah, so I definitely think being a woman can be really difficult because you have a lot of stigmas against you. If you complain, you'll just be considered, a complicated or difficult woman in compared to a guy that's complaining about the same thing that doesn't happen. And I also have seen a lot of times in the medical field that, women that come in with really complex histories and some autoimmune diseases or whatnot, a lot of times their symptoms are kind of put in the back burner of like, oh, you're being dramatic, or it can't be that bad, like how can you have this one that's bad. In addition to also like OB-GYN, endometriosis has been notoriously like now thought of as like a really painful thing. But even 10 years ago, 5 to 10 years ago, it was like, oh, they're being dramatic. It's just like your period. So I think that there is just so many added problems and difficulties when it comes to advocating for yourself as a woman. And, I've met so many amazing patients who are like, I'm going to advocate for myself. I'm going to keep going no matter what I look like. But I think it's really difficult to, even myself as a physician, it's hard to advocate for myself in those positions because I don't want to be looked at as some way. But I definitely think there's so many added layers when it comes to being a woman. And I think that, getting good doctors in the field is kind of what you need to kind of break that barrier. And I think we are headed that way. A lot of my classmates don't have those kinds of biases, but I think we're a long way away from
That
full.
makes a lot of sense. It's nice to feel hopeful about it for sure. And actually, it's interesting that you say that because I experienced a situation where I saw something going wrong in my care, a situation where someone should have been wearing gloves and was not. And I was sharing this experience at my PCP office, kind of saying, I was actually getting my blood drawn, and I asked her, is it standard for, I was being stuck for an MRI situation, and is it normal in some cases for someone not to wear gloves? Because I really thought, I've been thinking about this for a long time, and I knew that he should have been wearing gloves. And she said, no, never. I'm shocked. And a doctor happened to walk in and say, you know what, the same thing happened to me, and I knew he should have been wearing gloves, and he was not, and I still didn't say anything, and to this day I regret it. So it's everyone. It's even providers when it's just being on the patient side, so different. But I think it's nice to hear that people are kind of creating the space for us to advocate for ourselves, and a lot of your peers are kind of thinking about this as they pursue their full-time careers as a physician. More on the personal side of like pursuing medicine, how did your passion for medicine sort of evolve into a focus on patient advocacy?
Yeah, so I always wanted to be a doctor ever since I was like little, and it started off because I just thought doctors were like superheroes. They were the coolest people ever. They saved lives. But then as I started to actually get into medicine, I started to realize how broken the system is and how many people kind of go under the table and not get seen for so many things. And doctors don't fix a lot of things, or you come in with 10 complaints and maybe not even one of them is really fixed. And that's just kind of how medicine is. And I felt like, as I started getting into medical school and during the journey, I really realized that a lot of times patients just were not feeling heard. They had seen 10 specialists for this condition, but no one had asked them, like, what is the worst thing that you're going through? Like, can we handle like one at a time? I maybe can't handle all 10 right now, but like, what's the worst and what can I do for that? And I just think that so much of the care kind of is like, if it's not an easy, like, I give you this and we'll come back to it and it's fixed, it's like doctors get fatigued. And, it's difficult when you have a lot of complexity to your, medical conditions. But as a doctor, it's our job to make this relationship, if things aren't working in the right direction, to kind of pivot and to keep trying different things. And, sometimes we can't fix everything and we have to be honest about that. Some of these conditions are lifelong and some of these conditions are really debilitating. And there's only so much we can do in modern medicine. But I also think that honesty is something we need as well, which I don't think a lot of doctors want to be like, oh, I don't know what's going on and I'll help you figure it out. But I'm also not in the place that I know everything that's going on.
Right. It is such an interesting dynamic because as a patient, obviously you're dealing with this every day and you take for granted that the doctor's dealing with a million people a day. And so you're not really thinking about all of that. And it is a really difficult thing to sort of have to be patient with when you are, in pain or dealing with challenges or difficulties. So totally understand that. Another question I kind of had for you is just approaching the conversation before either a new procedure or, anything that could potentially be painful, if there's a way that physicians could approach this that, again, kind of creates this space for patient advocacy. Because I feel that sometimes I'll go into something, or I've heard my friends go into something and they hear this shouldn't hurt, this won't hurt, things like that. And so how does this conversation change? What can this look like that would be different and help us prepare for pain, or ask for something to alleviate pain during a procedure or anything like that?
I think this is difficult because no doctor wants to put anybody through pain. And a lot of times I think we get nervous that if it's going to cause you pain, you might not want to do it. And it's so important for you to get this procedure done. But I think that the first thing is to just be very honest and being like, you know what, the pain scale for everybody's very different. In theory, this shouldn't cause you pain, but I've had people, or there is a variety of people that can cause pain. If you are in too much pain, let me know and we can try to like figure out how to do it. Like, for example, so a colposcopy, that is when you take a little biopsy of the cervix. It's, to check for cervical cancer. I actually had one of those done, and, I've seen them done, and, they looked very painful during the time that I saw them done. But then when I went to get mine, my gynecologist was like, oh, it's not going to be painful. It's not going to be painful. It's going to be like a cramp. And, it wasn't 10 out of 10 pain, but in the moment of doing it, it was very painful. Like, it was very uncomfortable. Like, I got nauseous. I did not feel good. And I wish I would have been like prepped a little bit of like, what? I had seen this as like a student, and I saw people in pain, and I was like, what, maybe I just have a different pain tolerance than them. But in reality, like, it is painful, and everybody has a different pain tolerance. And I don't know why, we wouldn't just be like, okay, before the procedure, take some Tylenol, and then you come in, and then we can do it, and then we'll see if you're in pain, and then we can address that after. But I think it's a little bit as like no one wants to cause the pain, so no one wants to like be very upfront and honest about it. So I think it's being upfront and honest, and then also when you are causing pain, if it is something, some procedures you can't stop, like you can't be in the middle of it and stop it. But if it's a procedure where you can be like, okay, it's going to be really painful for 10 seconds, I'm going to do it, and then I'm going to stop, which is what the colposcopy was. It was like 10 seconds of like intense pain, and then it like didn't. But I didn't really know how long it was going to last, any of that, because I wasn't communicated that, even though I had seen it as a medical student. So I think it's just more honesty and, allowing patients to ask questions as well. I think that sometimes you don't know what the right questions to ask are because, literacy is so different that even myself, I would have been like, how long is the pain? I should have asked that, and I didn't know until after the fact. So I think
Right.
it's tough.
Totally. And colposcopy is actually one of the topics that comes up on our website. So, definitely a experience for those who have done it. It is one of those kind of infamous, we all talk about it. We don't really have solid information on it. It's just kind of word of mouth. And so that's kind of like what the website, unisoncommunity.com, is about, just kind of helping us prepare. And then what you said about the medical literacy too, just being ready to ask the right questions. And so that's something we're working on as well, and hoping kind of comes up in conversation on the website. But we also are looking to develop resources on that too, so that we kind of go in ready. But I guess so part of all, this whole project too is kind of understanding the physician side, because I think there is a lot that patients don't understand is going on the physician side. So how much of this would you say, I know you said a lot of it is about not wanting to cause pain, and really kind of admitting that something that a doctor does might cause pain, but also how much of this is just kind of lack of resources, being rushed? Do you think that those are factors too, or?
Yeah, I definitely do. I mean, I think in the medical field there is a physician shortage, and it's just going to get worse. So I definitely think, especially with my days, like I'm just a medical student, I'm going to be a doctor, but I am really busy. We have tons and tons of patients. So, for the example of the colposcopy, if you have an OB-GYN who has to do a colposcopy, but then has 4 patients waiting in the waiting room to go get their stuff done, there is going to be a rush, and there is going to be a time that you have to keep going. It's kind of crazy to me to see on the other side, as a physician, you only see people for like 15 to 20 minutes. A visit is a standard visit is 15 minutes, a procedural visit is 20 minutes. Sometimes it takes me 15 minutes just to talk with them and kind of figure
Mhm.
out how things are going. And a lot of the times it really depends on the clinic that you're at. Some people really would only take 30-minute appointments, but there are some clinics that really want to bust out patients. And how can you get good care in 15 minutes? Sometimes you can't even like get into the room and get comfortable in 15 minutes. So we're
Mhm.
running behind. We have people waiting for us. People are getting more upset that it's, you try to be as fast as possible, that, maybe a lot of patient advocacy is not that doctors don't want to do it. It's just more like they don't have the time to do it. They're here
Right.
to treat you and fix you and try to get, your biopsy or your treatment done. And they don't have the time to be like, oh, did you have that question? Is that question answered? Can I dive more into that? Because they're under such time constraints. And I think as a medical student, I do have a little bit of more leeway because I don't have as much responsibilities other people do. So I have more time to go and touch the patients. But I definitely am concerned for when I am a resident doctor to go see how much more work I have to do and how much of my patient advocacy is going to have to shift and being done at different times.
Yeah. No, definitely. That makes a lot of sense. And so just curious from your perspective, so what kind of support do you think future healthcare professionals need to stay grounded and empathetic?
Yeah, so I think a lot of being grounded and empathetic has a lot to do with taking care of yourself. I think doctors notoriously are really bad at taking care of themselves and really bad at giving themselves time, that you can't really be empathetic to anybody unless you're taking care of yourselves. And our medical, field is not really set up for us to have breaks. So I think that partially is you need to take care of yourself and you need to remember why you did this. I think a lot of people, as they've gone through the process, they kind of forget, like, why am I doing this? Why am I here? And, a lot of us, most of us that I've talked to, at least my classmates, is we're doing this because we love patient care. We love to help people and we want to get people from like their worst days and their most sick days to like the best days that they can have. So I think that it's taking care of yourself and then also just kind of remembering who this is. I personally like to think of every patient as somebody like my mom or my dad. My mom and my dad have both been in and out of the hospitals for different things. And, I've had really good care with them and I've had really compassionate doctors and nurses and people. And just the care that they give is kind of what I would always want to give my patients. I want my patients to feel as if, I care about them as much as I'd care about my mom and my dad walking into the hospital. And I want more doctors to think of it like that because I think we would be in a lot better place if that was the case.
I really like that. That's actually so nice to hear. And I'm curious, since you're in medical school, I mean, is there any part of the formal education that talks about this sort of empathy? I mean, we've all heard the term bedside manner, but to what extent is that? Just curious to know what you've learned or what is in the program.
Yeah. So I can only speak for Drexel, which
Sure.
honestly, they do a really good job. I mean, I have been so impressed with them. We have a whole course called Foundations of Patient Care, and it's a 2-year long course when you're in the first 2 years of medical school, where
Mhm.
you kind of learn to be a doctor. They first put you in like an ethics course, and then kind of throughout the year, you're kind of talking about really difficult ethical topics and like how to handle them. Then in that course, what you're also doing is you're going in with, we call them SPs, so they're standardized patients. And we just go and learn how to talk to people and kind of like be their doctor. And, they're like fake encounters that you're pretending to be the doctor and you have a patient there. And then you are getting recorded. So you'll have people grade you and you get to kind of watch yourself back and you get to see, was I empathetic there? Was I doing this right? Did I sound awkward? Was I stiff? Was it uncomfortable? And something as simple as there are seats in the room, in every room. And a lot of times as a first year medical student, you're standing over the patient, like hovering, and then you learn, let me sit down, let me like look eye to eye with them, let me like make them a human. So I think that it's something that, empathy is a lot of it's, you can have it without having to be taught, but a lot of times when it comes to being a good doctor, some things you just need to see other people and almost mimic and shadow kind of what good empathy is for doctors. So I think the first 2 years really kind of set us up right. And then third and fourth year, we kind of mimic what our attendings do. And we kind of talk a lot about empathy and compassion, and kind of you get to see what good physicians are. You also get to see what not great physicians are. And then you get to go forward from there. But I think the first 2 years of medical school was awesome for at least a Drexel.
Wow, that's really good to hear. That program sounds incredible. And also seeing yourself back must be really a really interesting experience.
A little cringy at the beginning. I'm like, oh, why did I say that?
It's so true, though, what you say about the sitting. I mean, body language is so much of it, and I haven't processed it till now. But whenever my doctors are talking to me or telling me something, they're always sitting, which is really interesting to think about now in hindsight. Wow, cool. Um, and, just curious, let's say you're on the patient side now. What is the best way? I know there's all different types of appointments, but generally speaking, what is the best way to prepare for an appointment? How can you get the most out of a session? You mentioned sometimes they're only 15 minutes. What is the best thing a patient can do to be prepared, be ready to advocate for themselves, anything else that's needed to really get the full what you're trying to get from the appointment, I guess?
Yeah, so I think that, one of the hardest things, sorry, one of the hardest things that I see with my patients is time. So I always am really happy when I see patients kind of coming with me with maybe like a short list of the most important things that they have for problems. Some patients have up to like 10 problems wrong with them, and that's just not realistic for me to treat, even if I had 30 minutes. So I think that one of the best things that you could do as a patient is to really come in with maybe 2 to 3 big problems that you want to work with, or big concerns that you have, and kind of dive more into the details of those problems. So if I have back pain, tell me, when the back pain started, how long it's been, what have you done to, help with the back pain, what makes it worse, all those things that, about the back pain. And then we can address the back pain. And then if you have knee pain, do the same thing for that. And then kind of focus on those things. And then, what, if you have other problems, we can make another visit. I know no one wants to come back for a separate thing, but a lot of the times it's really difficult to work through a ton of problems.
Mm-hmm.
Really dive deeply into something if you have like 10 problems, or, you want a ton of different things. It's very difficult.
Yeah.
So I really like that. And I think it's really hard, as I said, to be informed. So I always kind of steer clear of like the WebMD stuff or asking ChatGPT, because sometimes it'll just tell you have cancer. Everything can go down to cancer, and I don't want my patients to freak out. So I would always say, like, maybe talk a little bit more about the symptoms that you're having, and really kind of be monitoring of, like, if you're having symptoms all the time, like making sure you're also telling us that.
Yeah, definitely. That's really interesting. And I think something, kind of just side note, that I've been thinking about, because having these conversations, I've been hearing, the way insurance works and the system works, you should come back for a second appointment when you're talking about multiple challenges you're experiencing. And so I think the hardest part of that is sometimes is just getting to your appointment. And so I've also been thinking in the background too, because I'm a transportation planner, like, not everybody can access their appointments. And so I have a friend who's an endocrinologist who talks to me about all the time people missing their dialysis and other appointments they're having due to transportation. And this is in Nashville. So luckily I live in Boston that has pretty good transit system. But, if the best way to get what you need from your doctor and from your care is these other appointments, which I hear continuously, then that's like a whole other challenge that we need to solve as well. So just wanted to share that since I was thinking about it. But
I mean, it's so true. I think that goes into like the social determinants of health, where, it's really difficult when you can't get to your appointments. And, I think in Philadelphia, there are some support and some resources, and I'm aware of some, but they're not great and they're not
Mhm.
super consistent. That, when you have something like that, it makes it incredibly difficult. And I know as a physician, I'm telling you to come back. It's like, well, I can't come back. And I'm like,
Yeah.
it's like that hard balance of like, what do we do next? But I think that's a bigger systemic issue.
Definitely. I have noticed that they started, at least in Boston, they started asking me if I cancel an appointment, oh, what was the reason? But and then one of the reasons is like transportation. So they're definitely thinking about it, which is good to hear. And kind of on that note, thinking about at the hospital level, because I think a lot of the things you touched on in advocating for or helping a patient advocate for themselves was kind of, you on the individual level. Is there anything you've seen at the healthcare system level or hospital level that's helped facilitate this, or any change that you think could or should be implemented that would help facilitate this?
Yeah, so I mean, at the hospital level, I think there's a lot of people involved in the team. I mean, from social work to nursing to doctors to kind of everybody there, there's a lot of different patient advocacy. So I think a lot of the time, social work does so much of the patient advocacy and really kind of will come to me and talk to me about, a patient's like their stability at home or where they need to go or how they're going to be transferred or transportation in general is related to that as well as social work. So I think that there is a lot of, different departments involved. When it comes to doctors, if there's anything, I can't think of anything personal that I've seen that we help with advocacy. I think it's more embedded in us and our training.
Mm-hmm.
A little bit maybe on the discharge paperwork, we have information about, this is what you have, this is the appointments you have next, but that's not really advocacy. That's just more like setting you up to leave. Uh,
Mm-hmm.
that I think that from a doctor's perspective, I don't think there is much advocacy on our end. It's kind of our responsibility, and dependent on how good a doctor you have is how good they are at advocating for you or telling you about, what their problems are and kind of moving forward with that.
Then, just in terms of you personally, I mean, how did your background or mentors kind of influence your approach to empathy and advocacy in healthcare?
Yeah, so I have had a huge history of advocacy in my life. I am a dyslexic student, so I have had to advocate for myself all throughout undergrad, all throughout high school and grad school and in medical school. So I've been very big about advocating for myself and not really allowing people to tell me I can't do something, or whenever challenges are come my way, I will always tell people like what I can and can't do. So I think that that advocacy kind of just spilled over into my medical career, where, if I see a patient who, I'm seeing that they're not being able to advocate for themselves, I'm more likely to advocate for them with my team, just because I don't want anybody to not get the care or anything they don't need. And then I think when it comes to the empathy, I think it just once again goes back to, my family and seeing my family's members sick, that when I'm seeing my family members sick and I saw the empathy that everybody else gave them, it was kind of more like, this is the right thing you should do for anybody, because I had it done for me. Why wouldn't I pass it forward? So I think that that's kind of where I came from.
No, that's an amazing story. Thanks so much for sharing. I think, yeah, it's kind of also difficult to I'm sure it's difficult to see someone who's struggling to advocate for themselves and you're trying to help them and it's not always kind of panning out the way you want. But hopefully, I mean, I have hope that based on everything you're saying, that this will be kind of a good future for patients. And on that note, I mean, what gives you hope about the next generation of healthcare professionals? You've kind of mentioned a few programs at Drexel specifically and things that you've experienced, but curious, what does the future look like from your perspective in terms of kind of patient advocacy?
Yeah, so I am really hopeful. I mean, I think probably my classmates are one of the most hopeful things for me. I think that we're having this new entrance of medical students and doctors who are just more like down to earth people. I think that being a doctor has always been this like really prestigious thing, and you have to be super smart and the perfect student and amazing to do it. And in the end, we are just people. We are the same as you. And I think that, what I'm starting to see is we're in it for like the love of medicine and the interest of taking care of people and the love of science too. I mean, medicine is really cool when you think about it in the scientific way. So I think we're in it for the right reasons, where I think that I hope people will start to see just a more casual setting where you come and meet your doctor and they're just like you, just, had different schooling than you, and they just know different things than you, but it's not like they're better than you. I think that that was a huge thing for so many years, that doctors were they considered themselves better than a lot of their patients. And I think that's where we got into a lot of trouble when it came to how we would treat patients and what we would say to patients. So I'm just hopeful for the people that are coming in now.
That makes a lot of sense. And I could see, I mean, becoming a doctor in the US is such a long process, and there is somewhat of a competitive nature to it. So I could see it being difficult to kind of change lenses and transition and be like, okay, this is my patient now. So totally. And that's really nice to hear that there's hope. And I really enjoyed hearing about the program at Drexel, and I'm sure that other medical schools are doing that too. So it's just really nice to hear about the future of medicine. And something I always ask people, and this doesn't necessarily have to be related to advocacy for patients or anything, but is there anything in the health field right now that's exciting you, that you've read about, or a book you've read or podcast you've listened to that's been good information, or like a nice informational piece that you think people would like to read or hear?
Yeah, so I think that the thing that I just read was, I think it's Being Mortal by Atul Gawande. That's the book. It's a New York Times bestsellers a couple of years ago, and that's titled Being Mortal. And I think part of it is just talking about, we're all going to age and we're all going to transition and we're all going to eventually pass away, and kind of what that looks like. And it's taken the perspective of a doctor. He's a doctor, and I think he made it very clear that as a doctor, you almost feel like you're better than diseases and you're better than getting sick, because you're always around people that are sick, but you're not the one sick. So coming to terms with you are only human too, and you are going to get sick, is kind of like a big eye opening for me, where I was like, oh yeah, no, these diseases that I'm treating, like I hope to never get, but I could totally get them because I have a body just like you. And I think it put in perspective for me kind of just like how vulnerable people are and how vulnerable your
Mhm.
life is. And I think it could be related to like anybody. You don't have to just be in the medical field to read it, but I think that
Yeah.
it's a lot about aging as well, and like what it means to age and how we take care of our elderly in, America, which is not very great. A lot of people have had a lot of trouble throughout, especially since we're getting older and older generations, we're having a lot of trouble taking care of parents and grandparents and like what to do. That I think it was just a very interesting book when it came to kind of putting in perspective what it's like to be a human and be mortal.
That sounds really interesting, and probably I feel like it does tie into what we talked about today. Like it is a little bit humbling to realize, okay, I'm not invincible, and I'm out here always helping people. And I think it's also kind of having to think about yourself too now, which you're always thinking about and caring for other people. And so now it's like, how do I think about myself? So that's pretty cool. I'll have to check that out. That's all the questions I had for you today. Thank you so much for joining. I know you have a busy schedule, and we're so excited to kind of see where you go with your residency and everything. And thank you so much for making the time.
Yeah, of course. It was honestly a pleasure. I'm always loving to talk about medicine, patient advocacy, anything when it comes to medicine. So
Hi, everyone. Thank you for joining us on today's episode of the Unison Community Podcast. As a reminder, the information shared in this podcast is for informational and educational purposes only and is not intended as medical advice. This content is not a substitute for professional or medical diagnosis, treatment, or advice. Always seek the guidance of your physician or other qualified healthcare provider with any questions that you may have regarding your health or medical condition. Never disregard professional medical advice or delay seeking it because of something you heard on this podcast or read on the website. Thank you again for being a part of our community, and we hope to hear from you soon. Does your organization support women's health, empower women to better advocate for themselves, or to understand their bodies? Please reach out. We'd love to hear from you, whether for sponsorship, partnership, or just to connect.